beverages many times, at many places, and for many reasons. Almost anywhere we go, alcohol is there. Weddings, beer parties, birthdays, New Year's Eve celebrations, Christmas, the list is endless. Ours is also a driving society. Our social and economic structure places great emphasis on the car and driving. Young drivers frequently view the driver's license as passage into the adult world. The privilege to drive involves responsibility as well as more freedom and independence. Young people will drive and at times will be faced with situations and decisions involving alcohol, other drugs, and driving. It is nearly impossible to overstate the relationship between alcohol and traffic accidents, injuries, and deaths. One expert has described it as a national epidemic, another as America's socially accepted form of murder. More Americans have died at the hands of alcohol-impaired drivers during the past 2 years than were killed in the Vietnam conflict. On an average, about 3 Americans are killed and 80 injured by drinking drivers every hour of every day. It has been estimated that 1 in every 2 Americans will somehow be victimized by a drinking driver in his lifetime. Of the approximately 50,000 people killed each year in traffic accidents, 1/2 involve use of alcohol. This is the #1 health hazard for young adults, riding and driving with alcohol. Drinking and drug drivers kill and injure more teens than any other age group. A teenager is 4 times more likely to have an alcoholism or drug-related crash than any other age driver. Alcohol abuse causes an increase in driving problems. It can also lead to trouble with the law, job problems, school problems, family quarrels, and broken friendships. Why does alcohol cause these problems? First, many people are surprised to learn that alcohol is a drug. It's not only a drug, but it's the oldest, most common, and widely used drug in the world. It is a depressant that acts as a general anesthetic on the central nervous system. In fact, until the late 1800s, alcohol was used as an anesthetic for surgery. The body takes in alcohol quickly, but gets rid of it slowly. The drug is quickly and directly absorbed into the bloodstream without having to be digested. The first effect on drivers takes place between 20 and 40 minutes after the first drink, and is usually not noticed by the driver. All 50 states have laws against driving under the influence of alcohol with varying penalties. Most states base this on a person's blood alcohol concentration, or BAC, as determined by a breath, blood, or urine test. Most common is the breathalyzer test shown here. The proof you see on bottles or cans equals twice the percent of alcohol. This 80-proof brandy is 40% alcohol. And this bottle of rum is 151, or just over 75% alcohol. Blood alcohol concentration, or alcohol, is measured in hundredths of a percent, is easy to measure, and depends on the amount of alcohol consumed, body weight, and time elapsed since the first drink. A 12-ounce can or bottle of beer that is approximately 4% alcohol has about the same amount of alcohol as a 3 to 3.5 ounce glass of wine that is 12 to 14% alcohol, or a 1-ounce shot of brandy, whiskey, gin, or vodka. So all 3 of these kinds of drinks would have about the same effect on drivers. In a 150-pound driver, each would equal 0.02% blood alcohol, or 0.02%. A martini or a Manhattan or a drink mixed at a house party, however, may have twice as much alcohol and twice the effect on drivers and their driving. Another factor that can affect BAC, and an extremely important factor, is time. The time elapsed since drinking began, and the time since the last drink. The sober-up quickly techniques such as coffee consumption, exercise, and cold showers do not speed up the elimination of alcohol. Many people think this little stop will help significantly, but alcohol is eliminated from the body slowly, usually a little less than 1 drink or 0.02% per hour. When the consumption rate exceeds the elimination rate of 1 drink per hour for a 150-pound person, the effects are inevitable. Body weight is also a factor, since alcohol in the body is a process of dilution. The larger person, given the same amount of alcohol, will have a lower concentration in the blood. A final factor is the quantity and kind of food in the stomach before drinking. Food slows absorption into the bloodstream for a time. If a 150-pound person consumed 5 beers, each having 0.02% alcohol, he would have a BAC of 0.10%, a level that is considered legally intoxicated for driving by the American Medical Association, the National Safety Council, and the National Highway Traffic Safety Administration, as well as by most health and safety experts and state laws. This driver is considered physically and mentally incapable of driving safely. This chart shows the blood alcohol level with number of drinks at various body weights. Note a 120-pound driver with between 2 and 3 drinks is in an unsafe area of BAC. Of course, to base drinking and driving decisions on a chart can be misleading and dangerous. How one will drive after drinking is very difficult to predict. This chart shows the increased accident risk. We do know that the effects of alcohol are progressively worse as we continue to drink. The chances of having an accident increase 2 times at 0.05 BAC, 6 times at 0.10 BAC, and 25 times at 0.15 BAC. First effects on drivers can begin to occur with 1 drink at somewhere around 2 to 0.04% BAC. Reason and judgment. Am I going too fast? Is there enough room and time to pass? Should I slow down? As potential drivers continue to drink, inhibitions or restraints are depressed. And when driving, they may take more chances, become overconfident, more aggressive, and more impulsive. There is less concentration and concern. A state of mental relaxation takes over. Visual abilities, such as visual acuity or clearness of vision, field of vision, depth perception, and night glare vision become progressively impaired. Common behaviors of the drinking driver include unreasonable speed and driving in spurts. Excessive speed is common because alcohol is usually an aggressive drug for drivers. And frequent lane changing with excessive speed often occurs while driving at night without lights. Failing to dim lights and not centering the car in the proper lane are other symptoms. While in this manner, the driver may think he's actually driving better, feeling good, is more spontaneous, eloquent, more self-confident and skilled, and he is usually more emotional. As the blood alcohol content increases, the effects increase, and somewhere between 15 and 0.25%, all drivers become mentally confused, and between 40 and 0.50%, the result is fatal. Factors affecting how drivers will behave and drive include the mood the driver is in, their overall personality traits, the feelings and pressures of friends, the way alcohol affects them as individuals, their tolerance to alcohol, and their experience with driving, drinking and driving. It's for these reasons that people are affected differently, and the same person may be affected differently at different times. Difficult to predict, right? In summary, let's dispel some of the common myths surrounding alcohol, especially as it relates to driving. Myth: beer has less of an effect than mixed drinks or hard liquor. You can't come to harm if you stick to beer. Fact: a 12-ounce bottle of beer will have about the same effect on driving as a glass of wine, or shot of brandy, or other so-called hard liquor. Myth: alcohol helps my driving. It's a stimulant. Fact: alcohol doesn't improve driving performance, but makes you progressively less effective behind the wheel. It's a depressant that reduces normal restraints, causing drivers to act out and think they're doing better when they aren't. This is just the kind of outlook that is not needed when performing the driving task. Myth: alcohol always affects everyone the same way. Fact: not everyone seems to react the same way to the same amount of alcohol. Tolerance, size of person, personality all enter in. Each driver can be affected differently because of emotions, peer pressure, and physical illness. Also, the driver's attitude toward drinking, fatigue, and concurrent use with other drugs are factors. Alcohol is detrimental to driving performance. It combines overconfidence and a false sense of security with slower reactions, reduced vision, and faulty judgment. And it kills thousands each year, most frequently the young. Drivers must understand these impairments, and more importantly, must take the necessary steps to separate alcohol and other drugs from the driving risk.